Good afternoon. I'm Mahalia Joseph Wharton, and this is TTT Live. At this time, we take you now to the Diplomatic Center for today's weekly post-cabinet media briefing. We're bringing you live coverage on TTT and Talk City 91.1 FM, as well as on TTT Live Online on Facebook.
Good afternoon, members of the media, and welcome to our post-cabinet press conference. Today, our press conference will focus on the COVID-19, or better known as the novel coronavirus. Today at the press conference, we have the Minister of National Security, the Honorable Stuart, the Minister of Health, the Honorable Terrence Deyalsingh, and Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health. And we will start with the Minister of Health.
Thank you very much, Minister Cox. Good afternoon to ladies and gentlemen of the media, and a very warm good afternoon to members of the viewing and listening public. We are going to deal exclusively today with COVID-19. Since this issue started, the government of Trinidad and Tobago has been very forward with the media. We have been very transparent and proactive in dealing with the issue. I would not bore you with details about the global situation, you all know it. I will focus on the local response and local capacity to deal with the matter. Let me start off by saying that as of now, 1:30 on Thursday, March the 12th, there are no cases of COVID-19 in Trinidad and Tobago. There are no cases in the Port of Spain General Hospital. There are no cases in any private sector facility. Please ignore all social media reports to the contrary. And let me reiterate, which I've been saying all along, the day we have a confirmed case of COVID-19, once I alert the Prime Minister, Minister of National Security, and we take care of the patient and their family, I will come to you as Minister of Health and in all transparency alert the country via the media that we do in fact have a case, but as of now, there is no case. How have we been dealing with this situation? We started monitoring this since December 2019 into January 2020. On Thursday, 30th January 2020, we took our first concrete step approved by Cabinet, which was to impose a travel restriction on persons coming from China, except for citizens of Trinidad and Tobago. We started doing that for one reason only, to start to give us time to get our house in order. As time went along, we noticed the explosion in cases in certain countries, and we added 5 more countries to the list, which then had China alone. We included Italy, Iran, South Korea, Japan, Singapore. Again, that was to hopefully stop or delay the entry of the virus into Trinidad and Tobago, because the virus enters via people-human movement. Subsequent to that, because we monitor every single country literally on an hourly basis, you would have heard the Honorable Prime Minister, when he came back from London and Ghana, announce on Tuesday night that to that list of 6, we now added 3 other countries: France, Spain, and Germany. We have been monitoring the situation again, and Cabinet 2 weeks ago approved the setting up of a committee. You could call it an interministerial committee, but it includes police, commissioner of police or representative, chief of defense staff, a multidisciplinary unit under the chairmanship of the chief medical officer, to advise both the Minister of Health and the Minister of National Security as to any further measures that need to take place. Another mandate of that committee was to translate WHO's policies into action in Trinidad and Tobago. That committee has met twice. They met last week, Thursday, and they met on Tuesday gone, which will be Thursday the 10th. They are meeting again today, where both Minister Young and myself will be present, hopefully at around 2:30, because the situation changes rapidly from not only day to day now, from hour to hour. Coming out of Tuesday's meeting, the committee recommended the following. The Minister of National Security agreed, and we took a cabinet note today, which was agreed, that for the rest of the cruise ship season, which ends on April 24th, we are suspending all cruise ships visits to Trinidad and Tobago. If you follow the international news, you would see the drama that surrounds cruise ships that have confirmed cases of coronavirus on board. There is one now in San Francisco that is causing a lot of anguish and logistical nightmares for San Francisco. It is actually taking between 2 to 4 days for that ship to be totally emptied of people. You have to fly in supplies. You have to treat those people on land. We don't feel that we need to take on that type of risk. We want to preserve our healthcare system and our supplies, our test kits for Trinidad and Tobago. This will unfortunately affect both the Ministry of Trade and the Ministry of Tourism. At this point, I want to congratulate my two cabinet colleagues, Minister Paula Gopi-Schoon and Minister Randall Mitchell, who stood with us and had no hesitation in agreeing to the suspension of having cruise ships berth here for the rest of the season. That was done via their technical people at the meeting held on Tuesday. Both ministries were represented by high-level technical personnel, and the ministers, when I reached out to them, Minister Paula Gopi-Schoon and Minister Randall Mitchell, had no hesitation in supporting the decision. I know that this is going to have some effect on especially small operators. We know that. You know, the bus drivers, the tourism operators. I was in Tobago over the Carnival weekend and saw a cruise ship disembark. And at the same time, I went to visit the tomb of the mystery tomb in Plymouth. And there was a young lady selling stuff outside of a car trunk, making a living. And there were about 5 or 6 maxi taxis bringing business. She represents in my mind that there is going to be some hardship for these small operators. We appreciate that. We feel your pain. But sometimes we have to take action to protect the wider good. So this is going to affect 12 cruise ships for the rest of the season until April 24th, 5 to be berthed in Trinidad, and 7 in Tobago. So we know there is going to be some displacement, but this is for the wider good to protect 1.3 million people in Trinidad and Tobago. That was the big issue, to protect Trinidad and Tobago from having imported cases. Let me reiterate, the first case of coronavirus to hit Trinidad will be an imported case. It will come from the outside. We are taking every reasonable measure to stop and or delay the importation of cases into Trinidad. What we are trying to do also is the time that this has given us since we imposed the first travel restriction from January 30th to now is to get our healthcare system ready. And let me explain why this is important. Because we have to learn from other countries, especially the Italian experience, that you need to have now a country that is prepared for coronavirus now needs to have 2 healthcare systems literally running in parallel. One, delivering the regular services that hundreds of thousands of people use on a daily basis. All their outpatient clinics, you don't want them to suffer. All their surgeries, both elective and emergency, all your A&Es have to be running. Dialysis has to continue. Kidney transplant surgeries have to continue. Cataract surgeries have to continue. Everything has to continue. because you don't want to be treating COVID-19 patients in your regular hospital network, because that will be discouraging to people, because they may feel they may contaminate themselves, and also for the health and safety of healthcare workers, which is paramount. So in buying this time and in being very active on the ground, we have activated the Cora Health Facility, which originally had capacity for 4 quarantine or isolation beds. We have taken that up to a further 24? So we have about 28 spaces there up at Cora. And hopefully by tomorrow, the Couva Hospital will be ready to accept its first COVID patient if necessary. Because a certain small percentage of people will need intensive care unit treatment. And we don't want to treat those patients in the regular hospital setting at San Fernando, Eric Williams, Port of Spain, or Sangre Grande. So we are running now 2 parallel systems. One for COVID, one goes on as usual. If we need additional capacity, we are already in talks, I think, for Augustus Long Hospital, and coming online very soon will be the Arima Hospital. So we are going to have a lot of capacity to deal with COVID when it reaches here. But what we are doing when it reaches here is that we are immediately going to throw a protective blanket around that first imported case with contact tracing and a host of other measures to ensure there is no spread amongst family or community. So that is where we are as far as cabinet decisions coming out of the committee headed by the Chief Medical Officer to deal with the medical response to COVID-19. Thank you very much.
Thank you very much. Dr. Parasram?
No. Minister Young.
Young, is it?
Yes.
Yeah.
Thank you very much, Minister Cox, Minister Deyalsingh, CMO Parasram. Good afternoon, members of the media, wider viewing and listening public of Trinidad and Tobago. You've just heard a great synopsis of our current situation with respect to COVID-19 from the Minister of Health. As you would all recognize, this situation is a very fluid and a very rapidly changing one. I think the world last night observing a decision announced by the President of the United States understands now how quickly the circumstances surrounding this can change, but more importantly, the global impact it has. So, in our current discussions that are continuously ongoing, we have taken some decisions that the Minister of Health has just announced. But there are also some precautionary measures we'd like to suggest to the population. This morning, prior to entering the Cabinet meeting, the Minister of Health, myself, the Acting Prime Minister, and I also had a conversation with the substantive Prime Minister, as did the Minister of Health in Guyana before he departed for Trinidad. We took some decisions. In dealing with COVID-19, you're going to take certain steps. So you would have been hearing us announce along the way a number of steps that are being imposed. But there are also other decisions that you take along the way before going the full ambit with certain things that you see happening in other countries around the world. One of the worst, for example, being Italy. We're now seeing what the United States are doing. A number of states in the United States are issuing states of emergency based on health issues and these types of things. So the committee, as the Minister Deyalsingh said, I have asked for a meeting with the committee at 2:30 this afternoon. As soon as we finish here, we will proceed to that. I've also called a meeting with the security personnel, the heads of security, for tomorrow morning, which I will chair, to ensure, or to satisfy myself rather, that we are in a state of preparedness for national security to provide the necessary assistance as and when this develops. And it will take a number of different formats, from being assisting with first responders to, if necessary, public order and these types of things. At this stage, the government would like to advise the people in Trinidad and Tobago of the following mantras that we strongly suggest you immediately adapt into your lifestyle and adopt. Self-discipline and self-imposed caution. Those are the mantra words that I want to resonate with our population as we go forward and as we make further announcements and pronouncements along the way. What we are suggesting is that persons do not unnecessarily expose yourself to non-essential mass gatherings. There is no need at this stage to be taking risks and to expose yourself to non-essential mass gatherings. We have not taken the step of certifying or banning or putting public order bans on any of these events. We're asking people in the first instance to exercise your own self-discipline and caution. Limit your exposure to public crowds and to public places. Take precautions that I'm sure the CMO has been repeating to us throughout of using more sanitary measures, washing your hands, using tissues for coughs, disposing of what you've coughed on or sneezed on properly, and avoid touching your face. The next point that we're suggesting at this stage is please consider, when it comes to travel, only engaging in essential and emergency travel at this stage. We took a decision between Cabinet last week and the Finance and General Purposes Committee meeting of this week, which was held on Monday, that from a public service point of view, the government's point of view, we are only going to authorize emergency travel at this stage for public workers. But what we're asking the population to consider, and you're seeing it happening in other jurisdictions around the world, is for now, only limit yourself to essential or emergency travel. There is no need for persons to put themselves, their families, their loved ones, and the country at risk by going outside and bringing back the COVID-19. As you heard Minister Deyalsingh say quite clearly, the first case of this will be an intrusion into our system as opposed to being already amongst us. So limit yourself to essential and emergency travel. Of course, it goes without saying that persons should remain calm and not go into unnecessary states of panic buying and purchasing and hoarding and these types of things. Of course, be precautious. We understand that people are already taking certain precautions, but it is all at this stage about self-discipline and self-control. There is very little evidence that wearing face masks by the public makes a difference. We have had a couple of instances in the Caribbean that are very close to home. I had the government of Jamaica reach out to me this morning. They saw a false report that is circulating in Jamaica of three deaths at the Port of Spain General Hospital. As you've heard the Minister of Health say, completely false. So I assured the government of Jamaica that that was not true. But it makes the point. We need people to be responsible. And in particular, we are asking for the usual help of responsible journalism from you, the members of the media. Before you all publish anything, you can seek clarification from the Ministry of Health, Ministry of Communication, National Security, and we will provide you with what are the true facts that are in place at that point in time. I am certain that by now you all would have heard of the case in Alberta. The CMO reached out to the necessary health officials in Canada, and the person who the Albertan health official said was in Trinidad and Tobago, yes, the person was in Trinidad and Tobago, but stopped at a number of places on the way back to Canada, including that hub of Panama. When Minister Deyalsingh and I met with his technocrats 3 weeks ago, we had red flagged at that stage certain hubs. Panama is the closest international hub to us, with tens of thousands of persons coming in and then getting connecting flights and traveling out from. So this particular person went to Panama and then from Panama also to Colorado, if I remember correctly. So it was not a case that came from Trinidad and Tobago. There are instances where we are doing tracking, which we call contact tracking, for persons who have been traveling. Obviously, airlines are being affected. We have the necessary protocols in place. I'd like to take this opportunity to thank the Minister of Health, his Chief Medical Officer, and all of the staff. They have been nothing short of exemplary professionals in how we've been dealing with this situation. As he said, we have the national security apparatus in there, education, communication, all of the other facets that need to be around the table. And Minister Deyalsingh and I will be meeting with them at 2:30 this afternoon. and I will meet with the heads of security tomorrow morning. I've scheduled that meeting for, I believe, at 10:30. So at this stage, the mantras that we're asking people to consider is self-discipline, self-imposed caution. Do not unnecessarily expose yourself to non-essential mass gatherings. One example of that is the People's National Movement has taken a decision to postpone, to schedule until further notice, the walkabout that the Prime Minister had planned for this weekend. And these are the types of steps we're asking people to consider. And the public meeting thereafter. Don't unnecessarily go into mass gatherings to expose yourself at this time. And travel. We're asking persons, please reconsider your traveling plans. Only travel if it's essential or emergency travel. These are, of course, all being done as precautionary measures to delay and to protect. But you're seeing, as we sat there are cases in Cuba, a case in Guyana, 2 in Jamaica, St. Vincent and the Grenadines. So these are the cautions that we're asking you to implement immediately as of now, and we will continue to alert you as the time goes along.
Thank you. Questions? Okay, ladies and gentlemen, we go straight to questions, and please, questions pertaining to the coronavirus.
Good afternoon. In light of some confirmed cases in Jamaica and Guyana, any consideration into extending travel ban to any of those CARICOM countries or any of the other countries in the region who have reported confirmed cases?
The answer to that is no, not at this stage. As we have the protocol, if Ministry of Health advises the Minister of National Security, Prime Minister will take those decisions. But that is why we're saying limit yourselves to essential and emergency travel alone. It's only 2 confirmed cases in Jamaica, 1 in Guyana, 1 in St. Vincent at this stage, whereas you have thousands, for example, in the United States.
Just to follow up on Akash's question, Khalifa Vine, you say, just to follow up on Akash's question, what exactly is the criteria used when determining how to limit travel to certain countries?
So basically the rule of thumb is that you have to first of all have community transmission in the country. So if you don't have community transmission, it means that you only have imported cases in that particular country. Therefore, it is not a risk for someone visiting that country going and contracting. Community spread, and not only mild community spread, there must be widespread community spread to some extent. So you're looking at the scale and you're looking at the type of spread that is occurring. For Jamaica, they have 2 imported cases. So both of them were imported based on persons that would have traveled to, I believe, UK recently. So there's no community spread at this point, so they don't meet the criteria.
Karen Kozier for the TTT News. On that point, what about travel bans to the UK and certain areas in the US, maybe New York, where the cases have risen exponentially?
What I found particularly interesting by the decision of the President of the United States last night, you would have heard that the travel restrictions that he has put in place for the United States is a ban on travel to Europe, save for the United Kingdom, until the end of March, starting from Friday. We will continue to monitor the situation. We will continue to take advice from the experts, the medical personnel. You've just heard some of the test and formula used in the recommendation to the government, and it is something that we will continue to monitor. If people take heed of what we've just asked, that is to limit your travel to essential and emergency travel, by definition, that immediately starts to slow down the risk factor, because the numbers that are passing between the countries should dramatically slow down. But they will continue to do what they are doing on their end as we would on our end. But at this stage, that is not on the table before us.
Any concerns?
CMO can add to that.
So just to add to it, in terms of, we haven't taken the step of restriction as yet, but what we have added for UK, Canada and the USA is that we are looking at, we're actually monitoring anyone that comes from those countries for 14 days in the country. So that is being done through the county medical officers of health. So we're getting line lists of everyone from those countries that are passed from immigration division to the CMOH offices. We're monitoring them by phone for the duration of the incubation period. If they do develop signs and symptoms, they are quarantined and tested thereafter. So there's an additional measure that we have put in place. Right. So in addition, we have for UK as well, actually for all aircrafts, through the Airports Authority, we are putting in place passenger forms which will tell you basically signs and symptoms of the virus, who to contact if you are ill, so you could keep it with you when you're in the country. As soon as you get signs and symptoms, you know who to contact. So it will limit our exposure to the population. It will improve our public health response.
There's one point that I'd also like to raise coming out of what we've just suggested, which is the essential and emergency travel only. Sporting travel and events. You'd have seen taking place internationally, globally, the cancellation of a lot of sporting events. The Italian League, obviously, I saw announced, I think yesterday evening with NBA, they've decided to suspend the rest of their games for the season. These are just a couple examples. What I've just asked for, with travel to be limited to essential and emergency travel, should also be borne in mind by our sporting teams that are looking at going to events. This morning in Cabinet, there were a number of notes for public servants to travel, but as I said, we have taken a decision. It is only for emergency travel. So any sporting bodies, Trinidad and Tobago teams that are looking to represent, please take heed of what we've just said. I am certain that the events are going to move towards cancellation. You're seeing right now the Olympics for this year up in the air, no decision taken. I saw when I was in Cabinet reference to another large international sporting event. They're looking at postponing it for now. We have had some international conferences that were supposed to take place in Trinidad that we've postponed. Also, we had persons supposed to travel to other conferences that are now being postponed as well. So the same applies for sporting bodies. Do not go and unnecessarily put yourselves at risk and then the population at risk. It doesn't fall into the category of essential or emergency travel. So please bear that in mind.
Let me just add to that. I recently had a separate meeting with the Chief Medical Officer and the Minister of Education, because many schools were on the verge of going abroad for field trips. Also, I reached out to Mr. Vijay Mirage of the SDMS. He had a couple of schools, Lakshmi and a couple others, going on overseas field trips. I wrote to the Minister of Education, and he has agreed, and he has sent out the message to all school principals that falls under the category of non-essential travel. So all schools are on board, and they will be eliminating all overseas travel. They're free to go to Tobago, they're free to go to the Pitch Lake, but anything outside of Trinidad and Tobago, and I must say, every religious organization I have spoken to so far, I met with the Muslim community on Monday, and they accepted me warmly. They heeded all the advice, and they have taken a decision not to go to Hajj. Now, that is Hajj is a very sacred thing to the Muslim community. And for them to take this decision tells you how welcoming they are to the government's position. And for once, this is not a cliche. This is a whole of government, whole of society approach. And I'm very proud of the way all the organizations we have been speaking to have responded.
I know yesterday, Trains Bubble from the newspaper. I know yesterday, unfortunately, Guyana would have recorded their first case and also their first death. Have you been in contact with the Trinidadian delegation to Guyana over the past 24 hours? Have any protocols within
To the Trinidadian delegation.
the CARICOM delegation that visited Guyana? Have you been in contact with them? Had the protocols as far as travel changed for them? Are they doing anything differently?
The Prime Minister, our Prime Minister, is part of that CARICOM heads delegation. As I said at the outset when I spoke, I have been in contact with the Prime Minister, the substantive Prime Minister. Spoke to him this morning, and they are on their way back. It was a charter Liat flight. They had a press conference, I believe, as they wrapped up today, the heads, and they are on their way back to their respective countries. Now, remember, one case in a country doesn't immediately lead to the whole country is infected. I mean, we've had cases in the United States. There are a number of flights that come in from the United States on a daily basis in the United Kingdom and these types of things. So at this stage, continue to monitor when the Prime Minister's delegation come back. As happened when they came back from the United Kingdom and Ghana, they will be screened by Port Health on entry, and we continue to monitor what is going on.
Just to go back said, I know Panama and Colorado have cases, confirmed cases of coronavirus. They do. Well, according to news reports, Panama reported that. My question is, you said the person was in Colorado and Panama. What was the order of travel?
From Trinidad to Panama to Colorado to Alberta.
Okay, and how long were they in Trinidad to speak for?
About a week.
Also, you mentioned a state of emergency. Sorry, this is Parasram, Dr. Parasram. In the PAC yesterday, you mentioned that a state of emergency could possibly be a response to Tier 3 phase. My question is, in the U.S., when there's a state of emergency in a state, it triggers access to federal funding and other things. What would that trigger in our case?
Okay, go ahead.
State of emergency.
Yeah, so what would that trigger in our case?
So, the term state of emergency has different connotations to different countries depending on their constitution and legislative framework. How the state of emergency is being applied to the U.S. Instance right now, it does two things. It brings in federal troops to maintain law and order and access to federal funding. In the Trinidad context, the Minister of National Security and his people are already engaged in maintaining national security should COVID-19 reach here and if we need them. The issue of funding, the cabinet note I took to set up the committee also has a line in it that I will come back to the cabinet for any request for increased funding. We are in the process now of line iteming exactly what we need and putting in costs, and I will come to the cabinet next week with that. No. Has nothing to do with state of emergency.
So let me just put on my legal cap here to assist in the answer to this question. Exactly as Minister Deyalsingh has said, the U.S. system is a very different system. You have states, you have a federal system where the central government acts very independently of the states. That doesn't apply in Trinidad and Tobago. So when we say a declaration of a state of emergency, it's under our constitution for exactly that, emergency situations where we as a cabinet will determine we need to be able to impose curfews, keep people inside. So that would be the end of the road type of thing. We're nowhere closer. It doesn't assist us with the use of our security forces or funding or anything like that. So really for us to reach that stage, it would be because we have determined that we need to keep people indoors and that people are not heeding warnings, etc. We're very far from that.
Just to follow up on that, in a state of emergency type situation, I'm just asking here because I noticed in Jamaica somebody ran away from quarantine and then had to be recaptured. So is it in a state of emergency situation you've considered that quarantine might be mandatory rather than self-isolation?
It wouldn't have to be a state of emergency. One of the things we're looking at right now is the existing law and what laws we can utilize, etc. One of the reasons we chose Couva as a facility where we would quarantine people, if it came to that, is from a national security perspective. It makes it's a much easier place because it's isolated from any surroundings for us to be able to lock down.
Has there been any consideration or discussion regarding the closure of schools?
At this stage, that is premature. But as I say, this interministerial committee, Ministry of Education is part of it. It is very fluid. We will continue to monitor these things. Nothing is being ruled out at this stage. Nothing is, but you have to do things in increments and steps. At this stage and at this time, we think that is a premature conversation, but education is alerted. Education will continue to monitor, but understand we will always be driven in our decision-making process by the experts from the Ministry of Health and the advice that they provide.
You spoke with the Prime Minister, you spoke with the Prime Minister in Ghana. Did he indicate if he will be doing any self-imposed isolation when he comes back?
The Prime Minister has just come back from some very grueling travel. I mean, he was in London, Ghana, back to London, flew out the next morning after he arrived back in Trinidad to Ghana. He is going to take a couple of days off.
A couple of days off, out of precaution?
Well, I think he needs... he needs to take a couple of days off. Well, he wants to take a couple of days off. As I said, from the grueling travel at this stage, there's no level of concern. He will be screened when he comes back in this afternoon.
Your appeal to limit mass gatherings, how will that affect this weekend's Pagwa celebrations?
Well, again, we're asking people to just understand what we've just said. We're not imposing any ban on the Pagwa celebrations or any lockdown of Pagwa celebrations. They will need to take their own personal decisions, and that's why we said it's self-discipline, self-caution.
So, Minister Deyalsingh, I know you said there are no cases, but can you tell us if there are any persons actually in quarantine from the 49 samples that have been sent?
Checked a couple of weeks ago, and I did that same answer. There were about 7 people in various stages left in quarantine. So I can get that figure to you, the exact figure that we have.
But with 49 samples being sent for testing and coming back negative, is there like people in self-isolation?
Right. So as soon as you have someone in quarantine and they develop symptoms, we send the sample for testing. We get that back within 24 to 48 hours. Once it's negative, they can be released. So at all times, we'll have people going in and coming out of it.
Minister Deyalsingh, we receive calls and messages on YouTube about people who they think they have symptoms and they go to a health center. What I'm trying to find out, and so probably people can know, what exactly is the checklist that health centers use to figure out whether or not to test someone? Because people are saying, like people who have traveled to other countries are saying they've been told, oh, you have the sinus, go home, or it's just a common cold, go home. So what exactly is that checklist used?
Sure, it is a clinical and a public health decision, and it has to be case to case based on a proper history. So someone may have traveled to a place that may not have rapid community spread, come home, and when you come home, someone in the house would have had maybe a common cold. So the likely exposure in that case would have been, if it predated, would have been that the person in the household would have infected the person. So it has to be a thorough public health history determined by a physician to see exactly, what are the risks and to put you into a suspect case. So there's case definitions, which will, in this case, would be fever, shortness of breath, cough, a history of travel to an area where there's community spread. Those are the basic criteria that we use, but of course, drilling into each case, there's more detailed history that people will do to determine if there's a highly suspect case. Right, so...
Could we have a final question, please?
Yeah, sure.
Hold on, this is important.
So for now, what we are saying at present is that county medical officers of health, their numbers are throughout the country available, as well as the health centers and health facilities to call in the event that you have questions and concerns. The Ministry of Health is in the process of actually setting up a hotline, possibly more than one number to actually call in to actually do exactly that. So they'll do a history on the phone, they'll tell you where to go, if you are suspect, how to do your testing, answer FAQs. So that will be done in short order.
Okay.
Personal news. I just want to take it back to the Guyana case for a little bit. The lady, she traveled from New York to Guyana. One of the flights that goes to Guyana passes through Trinidad and Tobago. So I'm wondering, have we looked at her contact history? Are we paying attention to that situation?
So yes, since last night, we were able to trace that she did fly from New York to Trinidad in transit to Guyana, then took a flight from Trinidad to Guyana. So all of the contact protocols, contact tracing have been taking place. The CMO and his team are in touch with Cal, and all of that is taking place. Last one. We have to go to the Senate, yeah.
But how are we protecting people who are on the front line in terms of our response, people who are at the airport? And also, just to add to that, what is the process for people who come in, who are not nationals, and come into this country sick? Where do we say, no, you cannot enter, you cannot be airport? At what point?
We don't land them. So from an immigration point of view, if you've presented you're sick, we have isolation facilities at our international airports. They're put in there and then they're sent back. We don't allow them into the country.
How are we protecting?
Minister Deyalsingh said you did.
So at the onset, when I visited the airport way back in January, with the Chief Medical Officer and Dr. Osafo Fraser, who is the County Medical Officer but responsible for PRCO. One, we made all gloves and masks available to immigration officers from day one. And I have signed receipts for that, regardless of what Watson Duke has said. The health and safety of frontline personnel, whether they are immigration, whether they are customs, whether they are nurses, doctors, wardsmaids, are uppermost in the mind of the government. We have more than enough PPE, but we are jealously guarding it and not sending it out into every single area except for routine daily use. Reason being, and I have said this over and over, international supply chains for everything has been disrupted, including the manufacture of PPE. So the PPE we have, which is more than enough, we are jealously guarding. So when there is an outbreak in a particular area, we have total control over the stock and can rush it to the hotspot instead of having to find it from Labre to take to Arima. Yesterday, I gave instructions that an emergency supply of PPE be located at the Ministry of Health, 25 feet away from my office, so that the Ministry of Health now, where I and the CMO have access to 24 hours a day, 7 days a week, if the need should occur, we will have a strategic stock at the Ministry of Health, in addition to the stock at C40 that we could rush to a hotspot. In the unlikely event that our PPE supplies start to run low, in the unlikely event that that should happen, Trinidad and Tobago is a full financial member of PAHO and WHO. PAHO keeps in Panama a strategic stock of emergency PPE and emergency medication for infectious diseases and other diseases like malaria and so on. In that event, PPE, drips, anything else that is needed in Trinidad and Tobago can be rushed to Trinidad and Tobago from that strategic stock in Panama within 48 hours. So there's absolutely no discussion about the safety of frontline workers, whether it's immigration, customs, police, army, healthcare workers who have to respond to this. Thank you very much.
Are presenting symptoms but had no travel history, because we just had Carnival here, we had a visitor overload.
The other criteria we use is exposure, and that's why we have to take a detailed history. So you can be exposed to someone else that may have traveled or contacted someone that would have traveled. Right. So it's based on the exposure.
That's good.
So nobody's being turned down for a test because they have no travel history?
No, but there has to be evidence of exposure. Some sort of exposure.
Okay.
All right.
That was live coverage of the weekly post-cabinet media briefing on TTT, Talk City 91.1 FM, and on TTT Live Online on Facebook. Remember, we'll have more on matters coming out of today's briefing in our major newscasts. I'm Mahalia Joseph Wharton. Have a good afternoon.
Tournament experience is a